And so I sent this out to so many of my friends, my picture of me getting the vaccine with my little belly poking out.
So, what are the known risks for pregnant people getting the COVID-19 vaccine? Unfortunately for all of us, there were no pregnant people included in the vaccine research trial. 18 people did get pregnant during the course of the mRNA vaccine trials out of about 70,000 people, and we did not see an increased risk of miscarriage in that group. What is kind of more important is that the risk of COVID for people who are pregnant is a lot higher for people who are pregnant. That's an increased risk of hospitalization, need for intensive care, and even death. There are, some general risks with the COVID mRNA vaccines. The most common is a really sore arm, and I can speak from experience. My arm was quite sore after both my vaccines, especially the second one. There are also some fairly common other vaccine side effects that can last a day or two after the vaccine, including fevers or chills or body aches, and this is the body's immune system responding to the vaccine and kind of ramping up so it's better equipped to fight COVID if it gets exposed in the future. One really amazing benefit of the vaccine is that immune response and the parts of the immune system called antibodies that are like revved up by that process, those actually can pass through the placenta, and we'll know with time, but as we know with other vaccines, when those antibodies pass through the placenta, it actually gives the baby some protective effect against COVID that can last the first few months of life. So there is, a risk of feeling crummy for a couple of days, in some cases after the vaccine, but also the benefit to the baby of potentially not getting COVID in the future. It's a really, difficult decision, and I know it was for me when I made it to decide about the vaccine, and it's absolutely important that you talk to your provider before making this decision, and you make sure you get all of your questions answered, particularly the timing of the vaccine and what trimester. But I looked at all the data and found that the risks were the hypothetical risks, or the chance of feeling a little bit bad for a couple of days was just so much lower than the chance of protecting myself and my family from this virus.